All right. Thank you so much and welcome everybody. We all really appreciate you being here today. This is the third in a series of educational sessions that we've been doing called Compassion and Resilience Education at Work. So today's session is going to focus on stigma reduction. You may have been here and joined us for stress management as well as work-life balance. So we have a crew of educators here that we're going to introduce in just a moment. It is important to remember that we are part of the University of Florida IFAS Extension, and the University of Florida is an equal opportunity institution. So I'm going to turn it over to our main speakers today to have them introduce themselves.
Hello, everyone. My name is Wanda Adorno. I am the Family Consumer Science Agent in Seminole County.
Hey everyone, my name is Hillary Ayers and I am the Family and Consumer Sciences Agent in Orange County.
And if you heard me talking, I am Patrick Zayas, Extension Agent for UF IFAS Extension in Orange County.
And good afternoon, everyone. I'm Angelica Keene with the University of Florida Extension Office, Brevard County Community Development Agent.
So today's agenda, we're going to do some brief introductions. We will do a small icebreaker. Then we'll jump into terms and definitions. We're going to identify stigmas, and we're also going to be going over some stigma coping techniques. We did want to give just a little bit of a background before we go into today's session. The CREW, again, stands for Compassion and Resilience Education at Work, and it was developed by Purdue University Extension. And there are 3 sessions. So we had 2 previous sessions already. One was on work-life balance and stress management. And then the 3rd session today is about stigma reduction. We did just want to give a few notes on what this session does and does not cover. This session includes health education that is meant to inform. It is not meant to diagnose or treat specific medical conditions. The content is not meant to replace recommendations and treatments that a person may receive from a healthcare professional. And some topics may bring up many different thoughts and emotions. Some of these topics might even challenge your viewpoints. And so we do want to give you space for the wide range of experiences and differences that people bring here today. But if you do need to step away at any time to take care of yourself, you are definitely free to do so. And we want this session to be as useful for you as possible, but today's topic does have certain limitations, and we want to recognize that the best ways to reduce stigma may vary from each person. Again, our goal for today is really to reframe stigma and shift attitudes towards individuals that are struggling with mental health and/or substance use. And lastly, you all might have really many different reasons for coming today. That said, this session does rely on active learning with and from one another. So we do have a few guidelines that will help you get the most out of it. We do ask that you participate actively. Of course, we're never going to call on you. It is really, up to you if you'd like to offer your viewpoints or participate in discussions. But it is nice when we get to hear a lot of your different viewpoints. We ask that you just listen to understand, not just to respond. You want to remain open and respectful toward others' ideas and views, and then use suitable language. Don't mention employee names or individual names when you are talking about a situation. So in other words, don't call out others. You're definitely free to share, but again, don't mention anyone by name. First, we do want to do just a quick little icebreaker to kind of warm us up for any discussions that we might have. So please feel free to share in the chat a movie or what the last movie was that you watched that really made you laugh. Someone said Identity Theft last night on Netflix. Thank you for sharing. Anyone else want to share a movie? Rewatched Princess Diaries. Ooh, the new Beetlejuice movie. I'm going to go see that this weekend. Wicked Little Letters. Hook, Deadpool, Wolverine, Princess Diaries. Some of these I have not seen yet, and I definitely am interested in watching them. I've heard a lot of these are really funny. Someone just said there's a commercial on now where folks are just laughing, and it made me laugh. I love that you brought that up because laughter, right? We say laughter is contagious. So sometimes we see other people laughing and we don't even know, right? It could just be a commercial where we see people laughing and it can make us laugh. So that's right. Murder mystery too. I'm getting a lot of on my at home. All right. Thank you so much to everyone who shared. Now I've got a lot of ideas.
All right, that was some awesome movies that I heard. Okay, so moving forward, let's share some terms we often use when talking about mental health and stigma. Doing this together increases our own knowledge of the terms and ensures that we all have the same understanding of what they mean in group activities. Let's do an activity together in which you match a scrambled term with its definition, and then we will discuss the term later. Without looking at your handout, can I have the first volunteer to scramble the first word? The definition is an individual, emotional, psychological, and social well-being affecting how they think, feel, and act. You could put it in the chat, scramble that word, or you could unmute yourself, whatever you feel comfortable. I'm going to wait for a few response, and then I'm going to move on to the next one. Do we have any response in the chat box?
Yes. Rochelle said mental health.
Okay, awesome. All right. The next one is taking substance into the body that affects the mind. This can change a person's mental and sometimes physical states. Who could be the next volunteer to scramble this? Well, you could all put it in the chat or mute yourself.
There was an answer already in the chat.
Oh, that
So
was okay.
if anybody does want to come off mute, feel free. But it was substance use from Hollis.
Awesome. Yes. So they got it right. Mental health and substance use. Our next one is the negative social attitude towards a person or group thought to have mental, physical, or social fault. It can lead to the person's or group experiencing social disapproval, discrimination, and exclusion.
There was an answer in the chat already. And stigma.
Okay. Our next one is sensing someone else's suffering and wanting to relieve it. Any answers for that one on the chat box?
Yeah, Heidi got it. Compassion. Few
Awesome.
answers for compassion, actually.
Yes, so stigma and compassion. Awesome, thank you so much.
So when we talk about these terms, we mentioned a few things, substance use being one of them, mental health being another. It is really important to kind of elaborate on these terms because there's a lot of different variation when we talk about these things. So we did want to touch on this, and what you see on the left is what we call the substance use spectrum. And on the right, what you see are the stages of mental health. And let's start with the substance use spectrum, because I think it's really important to just kind of frame our conversation as we talk about substance use. Substance use is really just the use of controlled or illegal drugs, cannabis, tobacco, nicotine, alcohol. It could be medication. It could also be positive things. But essentially, substance use is different for everyone and can be viewed on a spectrum with varying stages of benefits and harms. So looking all the way to the left on the stage, the first one you see is abstinence. And so abstinence is non-use of any sort of substance. So this would be not using any sort of drugs, tobacco, alcohol. This could be prescribed drugs as well as recreationally taking drugs. The next step up from abstinence would be beneficial use of substances. So we're not saying that all use is negative, right? So if you're somebody with high blood pressure, you might be taking a high blood pressure medication, and that's going to be a beneficial use of a substance that you're taking, and it helps to keep your high blood pressure in check. It could also be something like ceremonial or religious uses of tobacco. There's a wide range when it comes to beneficial. As we go across the spectrum, you see that we're kind of getting into the non-problematic area, right? So non-problematic is also known as lower risk use. And lower risk use is going to have minimal impacts on a person, their family, friends, and others. For example, following the low risk alcohol drinking guidelines, right? So we know that there are different risks when it comes to alcohol, but it can be consumed in moderation. And so that would be considered a part of the non-problematic or lower risk use. As we go down, we start to see higher risk use, which is potentially harmful. So higher risk use is, again, just going to be a little bit more harmful and negative impact on the person, their family, their friends. It could be something like binge drinking, impaired or drunk driving regularly, the use of illegal drugs, increasing quantities or frequencies, or combining multiple substances. And then at the very end of the spectrum, we have what's called addiction, and also known as substance use disorder. So that is a treatable medical condition that affects the brain and involves compulsive and continuous use, despite negative impacts to a person, their family, friends, and others. So an example of this would be when somebody cannot stop using drugs, tobacco, or alcohol, even if they wanted to. It is important to remember that when it comes to the spectrum, all these different things have different effects on people, and everybody's going to have different responses to the amount of substances that they're using. The best way to avoid any sort of harms from substance use is to just avoid use altogether, right? That very first stage, which would be abstinence. There are some folks who we want to make sure don't have any sort of access to use. So things like children, young adults should not really be using any sort of substances regularly. And we don't want to, discourage when somebody does get to the other end of the spectrum. So when it comes to addiction and substance use disorder, recovery is possible, and it does look different for everyone. So it might be something like counseling, medications, or management, or all around services like employment and housing support. Transitioning over to mental illness, we've kind of view mental illness in the stage model, right? So instead of a spectrum, we have clearly defined stages. And so when it comes to mental health, the first stage is crucial to identifying early warning signs. And so often the first stage of mental illness is hardest to detect. That's because the initial symptoms of a mental illness are going to be quite minor. They might be something that you could easily write off as being a quirk, or however small they might seem. They may become more and more concerning as the symptoms begin to appear more, and the mental illness progresses to the later stages. So again, withdrawing from friends and family, beginning to show a decline at work or school, exhibiting a greater desire to be isolated or alone. These are all different parts of the first stage of mental illness. The second stage would be when an individual's symptoms can become more pronounced and visible. So during this stage, the person may become more likely to attempt to cope with the mental health via self-medicating practices, using things like drugs or alcohol as coping mechanisms. And then stage 3 is when the symptoms of mental illness start to become so severe that they impede their daily life. So this doesn't just affect the person struggling. So it could affect any person close to them, such as family or friends. And it can also, this is also where you start to see significant disruptions to daily life. And so it's at this stage that a lack of intervention becomes damaging in the long term to a person and those around them. So it's really critical to seek help if the symptoms of mental illness are so persistent that an individual can no longer function effectively in their life, and they are starting to hurt those around them. And then, of course, the fourth and often the final stage of mental illness is the most severe. And this stage occurs when an individual's mental illness becomes life-threatening. It is during this stage that self-harm becomes the most likely. Additionally, aggressive behavior towards others and lashing out at situations also becomes more frequent. So it's really important to remember that as stage 4 progresses, the potential for suicidal ideation escalates and may result in attempts. And so while it can be crucial to seek help in the first 3 stages of mental illness, it's really life-saving when it comes to the 4th stage. And so we do just want to kind of frame, because we talked about substance use and mental health, and just kind of give you a little bit more context and just understand there's different levels or a spectrum when it comes to these terms.
Mental health, and it's an umbrella term that includes many different experiences on the spectrum of illness to wellness. Mental health can therefore include short-term stress or early signs and symptoms of mental health or substance use issues. It could also include diagnosable mental health conditions or substance use conditions. Substance use occurs on a spectrum from non-problematic to problematic. Along the spectrum, it does not always change from one level to another in the same order. Stigma, there are different types of stigmas based on prejudice, fear, misunderstanding. We will discuss these terms later. Compassion has 5 parts. First, recognizing suffering. Second, understanding that suffering is a universal to the human experience. Third, feeling moved and emotional connected to the person's distress. Fourth, tolerating uncomfortable feeling to remain open and accepting of the person. Fifth, acting to alleviate the person's suffering. This is not a complete list of terms, but these terms come up often when talking about mental health and stigma. These definitions offer an overview of your understanding and should not be used to diagnose yourself or someone else. Moving forward, we'll be using these terms, so it is important that we all operating from the same understanding of what the terms and concept means. Now that we are familiar with some terms related to mental health, substance use, and stigma, we could think about ways to identify stigma and what it leads to. Then we can consider how each of us can reduce stigma in our communities. Without identifying an individual, please take a moment to think to yourself about a situation where there was a stigma. It could relate to mental health or substance use. If you feel stigmatized, what did you experience and what did it feel like? If you witness someone else being stigmatized, what was it like for you to observe that? What do you think it was like for that person? So I want to give you a minute to think about a situation, either that happened to yourself or that you witness. And I give you about a minute. All right, that was 1 minute. Now that we have thought about an experience with stigma in our lives, let us share how we can recognize it. There are 3 main ways people experience stigma: attitudes and belief, language, and behavior.
At the beginning of today's session, when we defined stigma, we mentioned that different types of stigma are based on prejudice, fear, or misunderstanding. These types of stigma include self, which is negative attitudes a person has toward themselves. This is also called internalized stigma. Public, attitudes the general public has towards certain individuals or groups. Direct professional, attitudes healthcare professionals have toward their patients. We also have indirect professional, which is an indirect stigma professionals experience from their connection to stigmatized people. And institutional, organizational policies or systems based on negative attitudes towards certain individuals or groups. It can be difficult to recognize stigmatizing attitudes and beliefs when they feel normal to our culture and upbringing. When something is part of your daily surroundings, you can become used to it, or you may not even notice that it's there in the first place. It can be like growing up somewhere that always has a strange smell. You may think it is normal for the world to smell that way until you go to a different place and learn how else the world can smell. That same thing can happen with stigma. We may not notice stigmatizing attitudes and beliefs if they feel so automatic and normal. So one way that we can build awareness for possible stigmatizing attitudes and beliefs is to really reflect on how we think about the world. So this is emailed to you. We can drop this handout into the chat as well. But your materials did include a reflection worksheet that you can use after today's session to really think about your attitudes and beliefs toward mental health and substance use. So we're not going to really in depth with this worksheet during today's session, but we really do encourage you to take some time to reflect after the session today. So definitely be sure to keep this worksheet for later use. To build awareness of stigmatizing attitude and belief expression is to think about language. Language reveals what people believe. It also has the power to shape people's thoughts and beliefs. Language, therefore, has the power to keep stigma going or to end it. Many commonly used words and phrases used to talk about mental health and substance use come from judgmental or even harmful origins. And really, without meaning to, we can continue to that stigma and do harm by using them. Research shows that word choice matters. So what are some examples of stigmatizing mental health and substance use language that you have come across? So just think about it for a moment. Again, What are some examples of stigmatizing mental health and substance use language that you have come across? If there is anything that you've come across, you're free to type it in the chat or even unmute yourself. Everyone has issues outside of work. Yeah, we all come, from different backgrounds. We all experience many different things. Right, crazy, right? Insulting, which is really insulting for people that are experiencing a mental health issue. Again, someone crazy, insane. Again, common use of the terms nuts or crazy to refer to chaotic situations, right? Again, using words like that is really insulting for people that are experiencing a mental health issue. So thank you for those of you who shared. While we don't really have time to explore fully what is behind each example of stigmatizing language, however, most stigmatizing language has these things in common. It frames the person or group as other. It defines the person or group by their mental health or substance use condition. And it suggests that mental health or substance use struggle is a character flaw rather than a treatable condition. And now that we have talked about, some examples of stigmatizing language, we can discuss ways to rephrase, reframe, or shift the language. And we can shift to language that focuses on the person as a whole and is less judgmental, which is known as person-centered language. And most person-centered language has these things in common. It is based in compassion. It offers hope for recovery. And it sees someone as having a full identity, not just defined by just one thing. So if you take a look at the screen, we have a stigma identification handout, which also should be emailed to you. We can drop that in the chat as well in that packet. But it shows examples that compare stigmatizing language to person-centered language. It's also displayed again here on the screen for you. So what I'm going to do is I'm going to read the stigmatizing language example, then I will read the person-centered language example, and then I will read the explanation. So stigmatizing language example would be something like, Jamie is bipolar. The person-centered language example would be, Jamie is a person with bipolar disorder. And having a health condition does not define a person's identity. Another stigmatizing language example is, Charlie committed suicide. Person-centered language would be, Charlie completed suicide. And this is because completed is a more neutral and non-judgmental term than commit, which implies a crime. Robin is a depressed person. To shift that to person-centered language, we would say, Robin experiences depression. Because depression is not a personality trait. Also, depression may not be constant. Recovery is possible. A few more examples of stigmatizing language. So Skylar is a junkie. Shifting to person-centered language, we could say, Skylar has a substance use disorder. Junkie is a judgmental term that's based on the belief that someone is less worthy. Stating that someone has a substance use disorder is a neutral fact about having a health condition. Jaden is an addict. We can shift this to, Jaden is a person who uses substances. An addict is a judgmental label that can be used to define a person. We don't want to judge ourselves or others for where this shift in language begins or for mistakes that are made along the way. We also don't want to judge someone for the terms they use to describe themselves. Some stigmatizing language really depends on context and culture. For example, some people from communities that have experienced exclusion or discrimination throughout history may take back certain stigmatizing or offensive terms. This can be a way to shift the meaning of the terms over time and for people to feel more empowered. Our role is to recognize the power of words approach others with compassion, and try to adapt when appropriate. We need to remember that the meanings of words and which words people prefer to use can change over time. People also express or challenge stigma through certain behaviors. And as we talk about how to shift from stigmatizing behavior to stigma-reducing behavior, we can address the next section of the stigma identification handout. So just as before, I'm going to read the stigmatizing behavior example, then I will read the stigma-reducing behavior example, and then the explanation. The first stigmatizing behavior example is stereotypes. Stigma-reducing behavior would be talk openly and honestly. And what this does is it undoes assumptions and biases. The next stigmatizing behavior example is exclusion and shame. Stigma-reducing behavior would be educate yourself and others. This helps to foster inclusion and connection. Gossip. Stigma-reducing behavior for gossip would be choose empowerment and compassion over shame, because this will help foster emotional safety and belonging. And lastly, minimizing, downplaying, or being dismissive. Stigma-reducing behavior would be to shift to more open, person-centered language, because this invites meaningful discussion and transparency. Compassion really is an essential strategy for reducing stigma. As with shifting language, we must show ourselves and others compassion and grace when shifting behavior. However, giving grace for someone making these changes does not mean excusing harmful or prejudiced behavior or language. According to the University of California, Berkeley's Greater Good Science Center, when compassion does lead to action, we often call the result kindness. Kindness always includes the intention to benefit other people, especially, though not always, at a cost or risk to ourselves. So I want you to think back to earlier in the session when you identified a situation in which you experienced or observed stigma. Take another moment to really just think about what types of stigma attitudes and beliefs, language, or behavior happened in that situation. Again, take a moment to think back on that situation in which you experienced or observed stigma, and then think about what types of stigma attitudes and beliefs, language, or behavior happened in that stigma. Then start to think about the consequences of the stigma. Give you just a moment. And I want to point out that the consequences of stigma can be far-reaching, but sometimes really hard to pinpoint. And I do see in the chat that someone shared, thank you so much for sharing with us, decreased self-esteem, right? That was the consequences of that stigma. So thank you for sharing that. And some other examples might be a person might hesitate to seek support from loved ones about their struggles. A person might hesitate to seek treatment for a mental health or substance use concern, even as symptoms worsen. And healthcare professionals who have stigmatizing attitudes and beliefs toward patients or clients might provide lower quality care than healthcare professionals who don't have those attitudes and beliefs. These professionals might also be less willing to work with patients or clients that are experiencing a mental health or substance use concern. And I do see some things in the chat, so I do want to go back and look at those. Consequence of stigma, we have worsened signs and symptoms, withdrawal from others, social isolation, lower offering of healthcare or insurance coverage. Yeah, there can be a lot of different consequences to stigmas that we experience. So thank you so much for everyone who shared that with us. So now that we've talked about how stigma is expressed and what it can lead to, we can start to practice identifying and reframing it in a scenario. You, in your email, in your handout packet, should have received a stigma scenarios handout as well as a scenario tips handout. We can also drop that in the chat for you all again. But when we are thinking about expressing stigmas, what it can lead to, we want to think about what we call REAL. So REAL stands for remain calm, engage with a caring tone, ask open-ended questions, and listen without judgment. So when we talk when we talk about these scenarios, we want to follow REAL. We want to be able to listen, engage, ask open-ended questions, and again, listen, remain calm and listen without judgment. This next section, or this next part of our session, I do want to point out it is optional. So we are going to go into breakout rooms. However, if you are not comfortable going to a breakout room, it is your choice. You can stay in the main session, or you can join the breakout room if you'd like. If you do want to join the breakout room, you're not required to discuss. You can simply be there just to listen, because we want this to be a safe space for everyone. So again, this next portion will be optional. But we are, again, going to split out into those breakout rooms. There are going to be 3 different breakout rooms because there are 3 different scenarios. And what we're going to do in these breakout rooms is we're going to work together to answer the following questions about which scenario you get. So the following questions we'll be thinking about. We're going to think about what type of stigma is expressed in the scenario. So is the stigma an attitude and belief? Is it language, or is it behavior? Then we're going to think about how could the person expressing stigma reframe their attitude, language, or behavior so that it's less stigmatizing. If whoever is in the group is comfortable enough, you are free to share. But again, this is optional. All right, I think we might still be waiting on a few people to come back. But I can say we had some great discussions going on. So welcome back, everyone. We want to take a few minutes just to discuss the 3 different scenarios. Again, each scenario was different. Scenario 1, which was the group that I was in, is there anyone who would like to share what we discussed? I can go ahead.
So in group 1, we kind of focused on the coworkers' response to Teddy and identified the fact that there was kind of 2 components of stigma here. There was both a dismissive, which was like that behavioral kind of piece, but there was also a huge component of stereotyping. And we kind of discussed both of those in kind of an overview. And then from there, we kind of looked at what we could have done differently or how the situation might go in another way. And some of the ideas was just opening with compassion, in addition to coming at it with that inquisitive mindset of like, if Teddy is struggling, what is it that is Teddy struggling about? And coming at it from that perspective and trying to work together on a solution versus just kind of adding more stress to the situation. Is there anything else, group, that I missed?
I think you got it pretty good. Thank you. Thank you for sharing. All right, and someone else in scenario 1 gave a thumbs up. All right, scenario 2. Is there anyone who was in scenario 2 who would like to share?
Scenario 2, we were riding solo, so
All right.
no participants in that group.
All right, well, maybe we can go over it just together briefly. So I'll read scenario 2 and then we can kind of talk about it together. So scenario 2 is Mac and Micah used to work together closely in the same department. They now work on different teams and do not collaborate directly as much as they used to. Micah had surgery in the last year and has been back at work for just a few months. Mac has heard rumors that Micah shows up late, is often drowsy on the job, and pops pills like candy throughout the workday. Mac concludes that Micah is probably hooked on pain pills from the surgery and is a junkie now. Mac decides that Micah is a collaborator. So then, thinking about this scenario, what type of stigma is expressed? Is it an attitude and beliefs, language, or behavior? What do we think?
Seems like an attitude and belief that's kind of leading over into behavior.
Mm-hmm. Yeah, he's Thank you. Yeah, Mac is expressing, right, that stigma through attitude and beliefs towards Micah after really just hearing all this gossip and assuming that Micah now has a substance use issue. And Rochelle says stereotyping. Yeah, just, oh, if somebody's drowsy on the job, they just had surgery, they're having to take pills, they must, have a substance use issue. Language, right? Language, is a junkie, right? So yeah, and he also just says, Micah's not going to be good to work with on future projects because of this. So now that we've identified the type of stigma that's being expressed, how could the person that's expressing the stigma reframe their attitude, their language, or that behavior? How could Mac reframe that stigma?
Well, I was the one that put language, and I think the first thing they could do is, reframe how they describe somebody who might have a substance use disorder. I think going from a negative word like junkie to just saying, Micah might have a substance use disorder. It's a small step, and it's a really big one.
Yeah, that's great, Patrick. And then we have in the comments from Jenny, engaging curiosity instead of judgment. I hope they were okay instead of just writing them off. Yeah, instead of just going on that assumption about what's going on, with Micah, hoping that they're okay, maybe just, supporting them in the way that they need. And then Angelica said, could have an actual conversation, right? Instead of basing their opinion off gossip. Yeah, have a conversation with Micah. Again, that goes to hoping that they're okay, pulling him aside and, just saying, hey, are you okay? Is there anything I can help you with? That way you're basing the information on fact, not on gossip that's going around. Well, that was great. Thank you, everyone. All right, let's go to scenario 3.
So I was in scenario 3 with Jenny. So we talked about this a little bit, and our real main takeaway was that this is a dismissive behavior. So ultimately, somebody expresses that they felt really down. They feel like they're bringing everyone else's mood down with them. So it's better if they just stay away. That's kind of their mindset. And then the supervisor, Jamie, just says, you need to just shake it off. And so we talked about how that was a very dismissive behavior on Jamie's part. We also talked about kind of the role that different people play in an organization. So as a supervisor, you have a little bit more of a responsibility maybe, or you should be a little bit more aware of kind of how this language, it's a different dynamic than if it is just like a colleague or a coworker, when your supervisor is just saying, yeah, just shake it off, you're okay. I don't know if you have anything to add to that, but that's pretty much what we were talking about in our session.
Yeah, I think, also, and those are really great things that you all discussed, again, don't downplay the person's experience. Let them know their value as a team member too. Showing that compassion. And then again, using REAL. So that REAL acronym, the REAL, from the scenario tips handout, instead of responding again with that discomfort and rolling your eyes, right? So just listening, being compassionate, again, listening without judgment and that kind of thing. So awesome, everyone. Well, we really hope, that examining these scenarios really gives you a chance, or gave you a chance, to practice identifying stigmas and then how you can reframe those stigmas. And you can apply these tools in real world situations to reduce stigma.
All right, to recap, in today's session, we discussed stigma and how it affects the ways that we think about mental health and substance use. We discussed some terms related to mental health and stigma. We talked about ways to recognize how stigma is expressed, and then strategies how to help reduce stigma in our surrounding. We encourage you to continue these conversations with your coworkers after today's session about ways you can support one another and reduce stigma in your work environment. As we have discussed today, the keys to reducing stigma around mental health and substance use are compassion and greater understanding. We are going to share some information If you feel that your circumstances have changed and you need help, or someone you know that need help, this might be some information that it could help you. At this time, does anybody has any questions, comments, or concern?
Before we lose everyone, before everyone exits, I do want to mention, we really appreciate those who have completed the surveys. I know there's one that follows right after Zoom, but the one on the QR code is separate. It's for our cooperative extension folks, and it would be extremely helpful if you could take a few minutes. I know we send out a few reminders, so we appreciate your time by taking that survey.
And if you have any questions, here's our contact information. Thank you so much.
Yes, thank you so much for joining us all today.